Hi friends, welcome back to my channel Sharing Simple Knowledge. Today I'm going to discuss about listening part A, and let's see how we can tackle this part and achieve full score in this part A. First of all, in part A you listen to a recording of two consultations between a health professional and a patient. That means a dialogue between the patient and doctor or any other healthcare professionals. So it consists of total of 24 questions with two extracts. So one each consists 12 questions. So 1 to 12 and the next one from 13 to 24. So if you achieve good score in part A, you will be on the safe zone. So what we have to know to achieve this score? So first of all, you need good concentration. So when you listen to these listening parts, try to stay relaxed and needs concentration. So as I told you before, it is a discussion. So when it will start, it will be introduction, then the patient will explain about his complaints and discuss about this medical history and the medications like that. So when you practice, just try to make notes what all medications you don't know or any, just follow the subheadings what they give you. So it will guide you to follow these extracts and just give the concentrate on specific information rather than the reading, and especially it will most of them from the patient side. So just listen to them what they are explaining, and sometimes they use the synonyms as well. So they may say persistent, but it mentions continuous like that, and also you have to be careful. So what else we can do? Initially they will provide a description about this conversation, that they will say it is a talk about a physician and the patient like that. The patient name will given. So during that time you can read and guess some answers. So it will be easy for you to get the answers. And other tip I would like to give, always try to use some short forms if the answer is very long. So you can write it elaborately later in the 2 minutes what they give at the last of this end of this listening part. So you can write that in detail. And in a listening part A, they're little bit liberal. Even though there is some spelling mistake, they will not be penalized and they will consider as right answer. So just we have some options there. And what all things we have to omit in this section? Don't jump ahead and back, so you will not be get the concentration and you can miss the answers. Just follow the gaps. It will be in the sequence of recording, so just follow the recording. Another tip is that don't waste valuable time by using an erase to correct a mistake. If you have made some mistake, just simply cross out any words you don't want the person marking your paper to accept. So this save your time and you can concentrate. So whenever you practice, just try to make a note if you don't know the medication's name. So next time when you listen to that medication, it will be easy for you and you can get that mark. And other thing is that you can listen to some podcast or any health articles, and I have done one video before, so you can see what all videos which will help you to the articles which helps you to improve your listening skills. So in that way you can also get good marks in listening part A, and it will be assessed by the examiner, not by the computer. So you try to make it more clear. Here I am giving an example so you will get some awareness how it will be.
Who has been referred by her GP due to a history of endometriosis. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look through the notes.
Hello, Miss Wells. Please come in and sit down. I'm Miss Moore, the consultant. I've read your GP's referral letter, which details your history of endometriosis. I wonder if I could start off by asking you a few questions. How old are you?
I'm 22.
Are you married?
No, but I live with my partner.
Have you ever been pregnant?
No.
And when was your last cervical smear?
That would have been done when I went to see my GP. Probably 3 months ago now. It was all normal.
Okay, great. Now, I gather you've had some pelvic pain recently.
Yes, that's right. It started in February of this year, a sharp pain in the left side of my stomach. It usually came on a few days before my period and then seemed to settle down at the end of my period. After February, the pain got really bad and it wouldn't go away. I was admitted to hospital.
Oh dear.
Yeah, the consultant there performed a laparoscopy and it revealed that on my left ovary and behind my womb I had endometriosis. After that, he suggested I should take... That's right. It started in February of this year, a sharp pain in the left side of my stomach. It usually came on a few days before my period and then seemed to settle down at the end of my period. After February, the pain got really bad and it wouldn't go away. I was admitted to hospital.
Oh dear.
Yeah, the consultant there performed a laparoscopy and it revealed that on my left ovary and behind my womb I had endometriosis. After that, he suggested I should take the pill without a break. But the pain didn't get any better, so he started me on progesterone tablets, which made me feel horrible. I put on weight and felt bloated all the time. I also developed acne. I hadn't had that since I was a teenager, but the pain still didn't get any better. So the consultant readmitted me in May of this year and performed another laparoscopy and treated the endometriosis with a diathermy. After that, I was much better and the pain almost completely went away. That was until August, when it returned. It's been slowly getting worse since then, and again, as in the beginning, it's in my stomach and it hurts just before my periods. Only now the pain is there at all different times and it really hurts when I'm having intercourse, especially in certain positions.
Right, I see. And are your periods regular?
Yes, regular because I'm taking the pill again with a week's break. The last one was about 3 weeks ago.
What about any other health concerns?
No, everything else is fine. I've never been a smoker, but I do like a drink at weekends. Just 1 or 2 though, nothing crazy. My family are all well too. No serious illness in either my mum or dad, or in my older sister. Nothing else I can think of really.
And do you have any problems passing urine or with your bowel motions?
No, that's all good too.
All right, Miss Wells. I think it would be sensible to have a look at you and run some tests. Then we can chat about how to take things forward. But from what you've told me, my initial suspicions are that the endometriosis might have come back.
That's what I
think you got an insight regarding listening part A, and just try to practice it very well so you can achieve higher score in listening part A and you will be on safe zone. Thank you for listening to me. Bye.